sedated, and for this purpose I'm using a standard video scope from Pentax. It's a diagnostic scope. Patient is in the left side position, and our colleagues here from this institution performed histoacrylate cyanoacrylate treatment of fundal varices, I think a few weeks ago, and therefore first I will check how successful they have been. So we are now in the retroflex position, and you can still see some superficial ulceration, but you can give me the probe. We can touch this part to see if it's still soft, if there is still an open varix, but it looks very nice. I think this shows the expertise here of this group. Excellent treatment, no more varices.
In your practice, you also use this battery?
Yes, yes, we do. We have not the restrictions as our colleagues from the States have, so we can use it in Germany and in, I think, most of the European countries. So, and now, don't worry, I will not activate now the APC. I use it just as a probe, so there may be a little bit more, but this is rigid here. Very good treatment. Okay, so I think this is nice, and we can also show the distal part of the esophagus. No real varices. I think he mainly had fundal varices. Okay, so, and now I'm approaching the antrum, and here we can nicely see the lesions caused by hypertensive gastropathy, and I think it's a good indication for APC, and therefore the patient has now the neutral electrode on his leg. And what I do, and I prefer to have the probe just a little bit outside of the endoscope, so that I have a better option for targeting lesions. And I want to avoid direct contact, because this may cause occlusion of the probe. And we have a flow rate of 2 liters, which can be inconvenient for the patient. So, if you treat patients for a longer time, you can also insert a gastric probe to reduce the amount of air. So now we have 60 watts, and we will activate now. I have to come a little bit closer. No, it doesn't work. Maybe the neutral electrode, is it really? Okay, now it works. So,
the plan for this patient would be to finish it all in one session, or how many sessions will you do for that?
It depends how much time you have. I'm here until Monday morning, and therefore if Ibrahim and the organizing committee allows me to continue, we can do it in one session. But I have...
So you try to finish it all in one session?
No, I think it will be too much here. And it's probably too inconvenient for the patient. We can increase the flow rate. So I have the impression I must come very close to the lesion. So, and we can also, what I've done in the piece of meat, I can do it like paint brushing. But I think I must come very close. Yeah, something wrong, because I must come very close to the. So it's better, yeah. Yes, please.
Dr. Neuhaus, in other words, what are the limitations for using of argon plasma? Is it the time, or is it the surface area you are using this, and what is the interval in between two sessions?
So we do it, of course, on an outpatient basis. That means after one session, the patient is discharged on the same day, and we recommend protopump inhibitors to avoid too deep ulceration. And then we repeat the session after 4 weeks. And after 4 weeks, the superficial ulceration and erosions are usually have been disappeared, and then one can repeat the procedure. And you see it's nicely possible. Now it's much better working than in the beginning. So I stay.
At which time do you stop?
Maybe usually after 20 or 30 minutes, I think it's enough. But now again, maybe we have to clean the tip.
Clean the probe?
Yeah, in between, as soon as you, and this is also...
Is it only the time that limits you, or you
Yes.
related to some surface area? Or something?
No. I'm not anxious about creating a too large area of coagulation. I think it's clinically irrelevant if the patient is under PPI. Before, colleagues asked me about the indication for ulcer bleeding. In active bleeding, APC is not useful because it will obstruct and occlude the probe. But you may, if you have done injection before and you only want to occlude a vessel, we usually prefer, do we have another probe? I think the probe doesn't work very well. Does not work? No, doesn't work. So you can use it after injection if you see
Introduce yourself first, please.
to ask a question about if there is any benefit of using
So can you please repeat the question? Did you get the question? Did you understand it? No. I'm sorry. Yes.
Is there any indication in the treatment of the solitary ulcer of the rectum?
Solitary ulcer.
It's a peptic ulcer. May use after giving the patient sandostatin to stop partially the bleeding?
I think you can try it. I'm not aware on larger studies on this subject. I have no experience with indication for rectal ulceration.
So you're bleeding peptic ulcer. So asking about even bleeding peptic ulcer after given sandostatin to stop the bleeding. Can we use
On peptic ulcer?
Yes, another. About rectal ulcer and peptic ulcer.
If you use APC? No, I wouldn't use it in ulcer. No, it's much better working. And you see if